Welcome to the HIMMS eNurse Mentoring Podcast Series. I'm your host, Ben Garrett. Today, my guest is Dr. Elizabeth M. Wirtz-Evans, PhD, RN, MPM, CPHQ, CPHIMS, FHIMSS, FACMPE, Executive Director and Publisher, Professional Practice and Programs, Oncology Nursing Society. Liz brings an extensive healthcare background, a notable education, and diverse professional experience in clinical and operational aspects of healthcare to her work in both hospitals and physician practices. With over 30 years of experience, her career has focused on patient safety and quality improvement, health information technology, new business development, regulatory compliance, practice management, financial management, strategic planning, joint ventures, education, and training. To further develop this blended experience in all types and sizes of healthcare organizations, Liz completed her doctoral degree, or PhD, through Capella University School of Business and Technology. Her dissertation research focused on the productivity of oncology nurses and how it was affected by technostress when using an electronic health record, or EHR, to improve the safety and quality of care for patients with cancer. Liz is also an accomplished author of both books and journal articles. The Oncology Nursing Society, where she works, is a professional organization of over 35,000 registered nurses and other healthcare providers dedicated to excellence in patient care, education, research, and administration in oncology nursing. Dr. Wirtz-Evans is also a member of the HIMMS Nursing Informatics Committee, the National Quality Forum Task Force, the Continuity of Care Task Force, and is a previous member of the Quality Outcomes Committee. Well, Dr. Wirtz-Evans, thanks for joining us today.
Oh, it's my pleasure. Thanks for inviting me.
Now, how did you transition from nursing into management, then from a management position into the IT field?
Well, I was in nursing for quite some time, and I was working on my master's degree, actually, and an opportunity became available for a manager position, and I thought, you can do a lot of things at the point of care, but if you really want to change policy and change the way things are done, then you kind of need to get into management. So that's how I initially got into management, and then I kind of worked my way up there. And then I was the CEO of a physician practice for 10 years. And probably 5 of those years we spent evaluating electronic health record systems and actually implementing an electronic health record. And I just loved the field, and I liked what I was doing, and I went to as many continuing education programs as I could to learn a little bit more about informatics and how nurses could contribute to that field. And then I joined HIMMS, and there's just, so much available from an educational standpoint, as well as when you get involved, you have networking opportunities with others. So I'm active in my local HIMMS chapter, which is Western Pennsylvania. Currently, I'm the president of that chapter, and then I'm pretty active at the national level as well, and that's really helped to solidify my interest as well as provide opportunities for more education.
So now, obviously, not all of our listeners will become a CEO, then transition into informatics. Are there guidelines to follow in a nursing clinical career to transition to both informatics and to a leadership position?
I think so, and many organizations that are either in the process of implementing an electronic health record or potentially evaluating an electronic health record really need the nurse's voice, because that's where a lot of the activity takes place, is at the bedside, at the chair side, whether you're inpatient or outpatient. And one of the things that we're seeing is that more nurses are getting involved in the evaluation process, which is really, really critical. In some organizations, it's management that makes that decision, and then when the electronic health record is rolled out, it doesn't work for the clinical staff. So I think if nurses are interested, they can get involved either on maybe the unit that they're working on, or maybe the physician practice that they're in, and then see the value of sharing the nursing information and partnering with the information technology professionals who are the ones that are actually doing the behind-the-scenes work. But it's important that the clinical piece is obvious to those that are designing or those that are choosing what EHR is going to be implemented.
Yeah, I think you've given us a good path to finding these kinds of positions and getting into this area. Do nurse informaticists and leadership positions need training beyond their nursing, such as business, communications, technology, or other areas?
I really think that they do. When we go to nursing school, you learn a lot of great clinical things, the nursing process and those sorts of things. Yet when you get into the informatics field, there's just so many more things you can build on your nursing knowledge, but I think that it's important, and that's no matter how much education you have, it's important to look at, for instance, HIMMS, and again, this isn't a commercial for HIMMS, it's simply that the information is available to build on your nursing knowledge and take that and kind of expand it and look at what's important from an informatics standpoint. In other words, one of the things that you really need to focus on is workflow. And as nurses, we really understand the workflow piece, but how is that interpreted on the IT side? And that's where nurses have an opportunity to learn a little bit more about how the IT system works. You don't have to know how to program and those sorts of things, but it's important to get some continuing education related to how things progress on the IT side. And you see some nurses that will go back and maybe even get formal education, whether it be a master's in informatics or, again, some go on to get their doctorates, but it's important that you build on the nursing knowledge. That I don't think going to nursing school and even the experience prepares you enough to enter the informatics field.
Yeah, that kind of leads to my next question because, in nursing, there's a certain amount of on-the-job training. There's one thing to do it in the classroom. There's another thing to do it at a bedside. What about informatics? Is the same true?
I would say yes, because, again, you can learn. You certainly can learn on the job. And, again, some of the things that we're seeing is that nurses are almost being forced to use a system that may not really be all that, quote, nurse-friendly. A lot of the electronic health record vendors have built their systems from more of a medical management, physician management piece, and we're not seeing as much from the nursing standpoint. So there's, again, it's another opportunity to get involved if it's something that you're excited about. Learn on the job. But again, I can't enforce enough, or I can't emphasize enough the importance of continuing education, so that you, as the nurse, know, wow, this makes a lot of sense, and then you become a resource for your organization to make sure that the clinical piece is just important as the technology piece.
You've given us a lot of guidance. What recommendations would you offer to nurses who want to learn more about informatics or other healthcare professionals who want to go to nursing school?
Oh, boy, that's a good question. Well, first off, nurses that want to get into informatics, first of all, you just have to ask. You may, again, work in an environment, whether it's inpatient or outpatient, where there is opportunity for electronic health record, whether it's, again, choosing one or implementing one. So, potentially go ask your nurse manager, nurse leaders, nursing directors, those sorts of things. Hey, I have this experience from the clinical side. Could I help with what you're doing from the technology side? In fact, there are many nurses that I know that progressed simply like that said, wow, I really like this. I'm very interested in it. So I'm just going to ask, hey, how can I get involved? So I think that's potentially the first step. For folks that are thinking about going to nursing school, again, there are many options that you can, depending on if you have an undergraduate degree or if you don't, there are, again, like I said, many options to do that. And we're seeing that there are now a lot more nursing informatics degrees out there, so maybe you do have your bachelor's in nursing and you want to go on and become an informatics specialist or an informatics professional, whatever you want to call yourself. There are opportunities to get a graduate degree in that. If you're somebody that is in a position that maybe you're not in nursing right now, again, there's an opportunity to go back to college or go to college initially and get that degree, and you can take some electives in informatics, or you can again, if that's not an option, the continuing education that's available through HIMMS. We also have a nursing informatics committee through HIMMS, and again, it's a lot of nurses who have just kind of stepped forward and said, wow, I'm really interested in this, where can I go? And kind of have changed their career around. Still have the nursing focus, but take that experience and apply it in kind of a different way.
Well, Dr. Wirtz-Evans, thanks for joining us today. I know all of our listeners really appreciate your insights in the nursing informatics area. Dr. Wirtz-Evans is one of the nurse mentors in the HIMMS Nurse eMentor program and podcast series developed in collaboration between HIMMS Career Services and HIMMS Nursing Informatics. You can find more information on the HIMMS eMentor program brought to you from HIMMS Professional Development Career Services on the HIMMS website at www.himms.org. Click on Professional Development and then click on Career Services. Thanks for joining us today.